Hello and welcome to Dog Days, where we talk about all things cannabis. I am your hostess with the mostest, Holly B, and today we are talking with Dr. Peggy. Welcome to the show, Dr. Peggy.
Hello, thank you for having me.
Absolutely. Now, your name is much longer. I'm not going to attempt to pronounce it. Would you like to pronounce your entire name, Doctor?
Either way, it's fine.
Okay, you're fine with Dr. Peggy?
Yes.
Okay, awesome. So you are a pharmacist and you're in the cannabis industry. I love these stories. I think we know each other through Dr. Leah Johnson, who is also a pharmacist, and I just love her story that because you're dealing with big pharma and that constantly being kind of beaten to your head, but now you've kind of come from the dark side to the light side. Is that kind of a stretch to say?
Yes, absolutely.
I love these stories. You do have an introduction video that I really enjoyed. Is it all right if we go ahead and play that as an introduction?
Of course.
Hi, I'm Dr. Peggy. I'm a pharmacist, and I've been practicing as a pharmacist dispensing medication for years. There were times that I was questioning why people end up taking many medication and they still need help, or why they end up taking medication that is causing side effects. And there also is time that I lost a patient because of the interaction between a medication and a glass of wine. That brought me to the world of alternative therapy. In 2019, I established a pharmacy. I registered it to the board, but I started dispensing herbal medicine, and I compounded with herbs, specifically cannabis, to help with conditions I call drug addiction. For example, pain, anxiety, sleep. And I experienced helping many patients, weaning them off from highly addictive medication. And also, I was able to offer alternatives sometimes to medication or complementary to what they were taking, increasing their quality of life and helping them live longer. If you're a patient and you're tired of taking medication, or you think that you're taking something that is not helping you, or you have a long list of medication and you're seeking help, I would love to be your resource. Or if you're a business and you're looking for developing a product that is herbal alternative, it can be cannabinoids or non-cannabinoids, I would love to be your resource because I have an extensive experience of working with cannabinoids, the combination with herbs, with mushroom, and I will be happy to help. I think as healthcare providers, we should all come together, educate our patients, and introduce them a new world because people need help. We can be a resource for them. Check me out on my website, Hempeutics.com. Fill out our intake form if you're a new patient, or fill out our client intake form if you're a business and you need help. Thank you.
I can't hear you, Holly. Holly, okay, you're back now.
Yeah, I turned myself off to make sure that the video played it well. But I love that story, Dr. Peggy.
Thank you. I appreciate it.
So I'm bringing up your website here, so we have that as well. And there's a patient intake according to your video. Where
the way it works, my practice is different. I like to keep a track of my patient.
Okay.
Offer consultation, then customization of formulation. So they get to the first page of the website and fill out the new intake form.
Okay.
It takes about 5 minutes, just the basic information, weight, height, and their contact. And then based on the information that they enter, like their history and other factors, then I'll make a decision what formulation is best for that patient.
Wow, I love that. Because so often, unfortunately, folks walk into dispensaries and it's just basically, hey, what's on sale?
Yes. Yeah. I figure that this is a challenge in the industry, especially for elderly. They don't have access to the right information and right resources. So we treat every person as a patient, not a customer.
Oh, beautiful, beautiful. So, every mission-driven journey comes with roadblocks. What were some of the biggest challenges you faced, and how did you navigate them?
Well, I'm sure that all of us as business or owners, we have a stories, but we all know that the business of cannabis is still in gray area. And being in healthcare and offering cannabis formulation has been a very interesting journey for me. Not just the stigma that we had to overcome, but also the regulations and banking. I remember days that my bank account was shut down and I had to just walk out, with a check that could not even cash it in any other places. And we all had our own days, but I definitely had my own days. There were days that my sign would not go up because the person that was doing a sign and she did not want to get involved with anything about CBD.
Oh my
The owner of business was giving us hard time, and the owner of the building. So we had our own issues, and then the other side of it, there are many doctors. We have a lot of good doctors. We have a lot that are in healthcare that are already educated and they're ahead of the game. But we also have some doctors that they're still not, they're not taking an action, and they're not educating themselves, and they talk the patient out of this. And we do a lot of work to make sure every patient is taken care of. But at the middle of our care, we figure out a doctor, gives the wrong advice, unfortunately. We've seen it both sides, but these are definitely the challenges that I've faced in the industry.
Oh, wow. That's so disheartening to hear. And you're out of California, correct?
Yes, I'm in
And you're
Huntington Beach.
holy cow. And you're still having those stigma type of reactionary actions happen against you. That's kind of shocking. That's and disappointing to hear. I'm sorry to hear that.
Well, it's getting a lot better. Again, we have many providers that are educated, that they know about the industry. I get many referrals from the providers, and I appreciate that. I have a lot of good contacts, and there are many that they already know about this. But there's some others that they're not that open minded. And what's heartbreaking, like we're working on a patient, and then and the patient talks with the provider, and because they don't know about it, they talk the patient out of it, and the patient stops the treatment. So that's the challenge that we have.
Oh no. That's terrible. Yeah, but I'm glad to hear that there you guys are making strides and having doctors get educated on cannabis. We really need to have that as like part of the curriculum, wouldn't you think?
Absolutely. Also, I encourage everyone as a patient to take action for their own health. We have a lot of good providers, but everybody is learning in this world, and now it's a world of technology. There are a lot of good access to resources that are reliable. Please, whatever your doctor recommends, you still, when you get home at the end of the day, look up and see what's going on. Look up for the side effects of what you're taking, and look up for interactions, and take action for your health. Because when you go to a doctor's office, sometimes they have limited tools. They want to help, but they only use the tools that are trained for. And so it makes sense that they don't recommend things that they think if they're outside of their scope.
Yes. Absolutely. Well said. So, what advice would you give to someone who wants to build a purpose driven business, especially in wellness and holistic health space? What kind of advice would you give?
Well, I work with many businesses. Over time that I got familiar with the formulation, there were businesses that they wanted me to develop product with them. And I had some successful CBD businesses. They're still in business and they're doing well. And unfortunately, I had some other that they went out of business. So I hear sad stories sometimes. I'm passionate about my client, and it's similar to my patient. You know, I'm passionate about my patient and my client. So if you open a CBD business, make sure that you understand about this plant. Educate yourself first. Don't get into the big business because of the fantasy of being in a cannabis industry. This field is challenging. You have to be passionate about it. You have to know your contacts. You have to know your customers. Not every product works for every business. Many people, when they get into this business, they order a large quantity of product from a manufacturer and put their own label on it, or even they tend to sell other brands. This is not how it works. If you don't know what product works for what, if you don't know what customers are gonna, will be your customers, and if you don't know if this specific product is right for you, you may end up losing the business, unfortunately, because there are a lot of challenges on your way. You have to be knowledgeable, you have to be educated, you have to be passionate, you have to know your resources. So be careful. I encourage you to be in business. Definitely, it's amazing field. There are a lot of new things coming up every day. I love this field. I've helped many people in this field, but be careful about it. You can also be out of business, but not knowing what you're doing.
Yes. Yes. Oh, that's wonderful advice. You hit the nail on the head for sure. So, some of the things that you specialize in is seizures, cancer, pain relief, anxiety, insomnia, pet support. That's quite a lot there. So, yeah, definitely dealing with pain management for the insomnia. Have you heard about CBN? Is that really effective for insomnia?
Yes, absolutely.
Okay,
There,
cool.
there are many cannabinoids in a plant, and when I formulate a product, I normally infuse multiple cannabinoids in one formulation, and based on what indications we're targeting, pain versus anxiety or sleep, my formulation varies, and so I increase concentration of specific cannabinoid to help with that condition. CBN is one of the cannabinoids that is calming and it helps with sleep. But I also like the synergy effect with the CBD. Yeah, we make amazing products for sleep.
That's awesome. So you kind of do the ratio thing, like one part CBD, one part CBN, just kind of like working with the formulations in that way. And terpenes, do you throw some terpenes in there?
Yes, absolutely.
Beautiful.
When I see a patient, my daytime formula is different than my nighttime formula. So many of my patients are on day and nighttime, and also sometimes they're also on a topical. I've helped many pain patients. We have a lot of pain, we have a lot of anxiety. We also use mushrooms, functional mushrooms, to help with conditions as well. They do amazing in ADHD. We have a great formulation for ADHD. So yes, it's very interesting.
I love it. So this is kind of interesting. Nano fast acting. So can you kind of quickly give me an update on what is nano fast acting?
Nano fast acting is water soluble formulation.
Cool.
Includes like basically it's a new technology that they break down the molecules to smaller particles, and it can be suspended in water, and because the particles are smaller, they absorb a lot faster.
Wow. Wow. And you're doing that in your laboratory?
Yes, I also
Amazing.
partner with some resources.
Beautiful. Beautiful. You're on the cutting edge, Dr. Peggy.
Thank you.
So let's do one more question here. For people who are struggling with chronic issues and feel failed by the traditional system, what message or guidance would you share with them today?
If you're a long list of medication, it's time for you to wake up and look into your drug regimen. I see patients that they continue adding to their list. Please take action for your health. Please see when a patient walks into my clinic. First, we look into the drug regimen, what medication they're taking, and then we also check mark those that they can be out of the list. So please take responsibility for your health. There are many options out there. We know that if you have a chronic disease or chronic situation, you need help. We know that you need help. We're not here to judge, but we also want to bring awareness. We want to let you know that there are options. You don't have to end up with a long list of drugs, with just simple things like changing in your quality of you're changing in your diet, changing in your lifestyle, and then taking a few herbs and taking some CBD. You can delete 4 or 5 of the medication off of your list, and we've seen that a lot. So, and that helps to increase the quality of life, and that helps our patient to live longer.
Beautiful. Well said. I love your message. Thank you so much for coming on. And definitely, folks, check out Miss Dr. Peggy's website. Shoot her an email, give her a phone call. We've been putting her contact information up throughout our interview to hear this today. So reach out to Dr. Peggy and see what they can do to help you out. Thank you, Dr. Peggy, so much. Hey, stay safe out there, everyone. Until next time.
Thank you. Have a great day.